So, so we shall deal today with normal labor. Normal labor is otherwise known as eutocia. 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 Normal labor is otherwise known as eutocia. So, what does the how the mechanism of labor is initiated? That's the term which we are going to focus on. So, mechanism in initiation of labor, how the labor is initiated. So, somewhat like an X factor, the factor which we are not aware of, the factor which the medical team is not aware of. So the X factor, anything from the X factor. Okay, so from then any substance from the X factor will activate the fetal hypothalamo pituitary adrenal axis. Okay, so the X factor means we don't know what is the factor is. Okay, so the X factor will activate, it will activate the fetal hypothalamo pituitary adrenal axis. Okay, fetal hypothalamo pituitary adrenal axis. So when the fetothalamo pituitary adrenal axis is activated, guys, please mute your mic. So fetal hypothalamo pituitary axis is activated by some of the factor which we are not aware of. So what happens when the fetal hypothalamo pituitary adrenal axis is activated? It will leads to fetal hypothalamus. So mainly it will affect the fetal hypothalamus. So as you know, the first and the foremost thing, hypothalamus will be activated. So when the hypothalamus is activated, the fetal pituitary will be activated. When the fetal pituitary is activated, ACTH, adrenocorticotropic hormone, will be activated. From the adrenocorticotropic hormone, fetal adrenal glands will be activated. So when the fetal adrenal gland is activated, it will increase the cortisol. Okay, it will increase the cortisol. So this increase in the cortisol will act on the placenta. Clear? This will make it changes in the placenta. So any unknown origin, there is an activation from any unknown origin, it will activate the feto-hypothalamo pituitary adrenal axis. Further, it will activate the fetal axis, the fetal hypothalamic axis. When the fetal hypothalamic axis is activated, it will further activate the fetal pituitary gland. Then it will increase the production of ACTH, adrenocorticotropic hormone. From the when the adrenocorticotropic hormone is released, it will increase the fetal adrenal secretions, that is cortisol. Cortisol will directly act on the placenta. So when the placenta is activated, see, next we have the major portion. When the placenta is activated for the labor, clear? When the placenta is activated for the labor, two stages may happen. One is increased estrogen. It will increase the estrogen, and second one, it decreases the progesterone. Okay, this is important. It will increase the estrogen and it will decrease the progesterone. So this estrogen will act on two things. Okay, it will act on two things. So first one is altered balance. Okay, it will alter the balance. Alter the balance. Okay, here the progesterone will positively alter the balance, whereas the estrogen will positively alter the balance, whereas the progesterone will negatively alter the balance. And here what happens as a second stage, the increased estrogen will act on maternal pituitary. Okay, it will act on maternal pituitary. When the maternal pituitary gland is activated, it will release the oxytocin. Okay, it will release the oxytocin. When the maternal pituitary is activated, it will release the oxytocin. So what happens when the oxytocin is released? When the oxytocin is released, it will act on myometrial contraction, that is uterine contraction. Okay, when the oxytocin is released, it increases the myometrial contraction. And what happens when there is an altered balance? So this altered balance will again act on the placenta, the amnion, as well as the chorion. Okay, it will act on the placenta, amnion, as well as the chorion. So when what happens when the placenta, amnion, as well as the chorion is altered. So all these things will lead to increased oxytocin level. Okay, so it leads to increased oxytocin level, and as well as it increase the prostaglandin E2 receptors alpha, as well as it increases the prostaglandin F2 receptor, F2 alpha receptors. Okay, prostaglandin F2 alpha receptors. Clear. So once again, due to any factor of origin, it will activate the fetal hypothalamo pituitary adrenal axis. It further will activate the fetal hypothalamus. From the when the fetal hypothalamus, it is again activated by the fetal pituitary, and it releases the adrenocorticotropic hormone. And it will act on the pituitary adrenal axis. That is a the fetal adrenal gland. And when the fetal adrenal gland is activated, it leads to it release the cortisol, and it again act on the placenta. So what happens when it is acted on the placenta? Two conditions occurs. One was increase in the estrogen and decrease in the progesterone. So when there is an increase in the estrogen, it will act on the maternal pituitary gland, and it will also change the balance of the body. So when the maternal pituitary is activated, it will release oxytocin, and when the bodily oxytocin is released, it leads to increased myometrial contraction. In the same how, due to in the same conditions, due to the altered balance, it will act on the this placenta, amnion, as well as chorion. When it is activated, it leads to increase in the oxytocin level. It will increase the prostaglandin E2 as well as prostaglandin F2 alpha. Okay, so all these things will again affect the it will increase the oxytocin level. So when the oxytocin, this is a chain cycle, okay, chain reaction. So it will again affect the maternal pituitary gland. So, and what is Ferguson reflex? Have you heard about Ferguson reflex? Ferguson, Ferguson reflex. Ferguson reflex is nothing but increase in the oxytocin due to vaginal examination or amniotomy. Okay, Ferguson's reflex, increase in the oxytocin due to vaginal examination and amniotomy. Clear. And what are the contraction system of the myometrium? What are the contraction system of the myometrium? So pardon?
There are reflex on sir.
Oh, Ferguson reflex, FERGUSA. Ferguson reflex when you're doing vaginal examination or amniotomy, there is an increase, oxytocin will be produced, or increased oxytocin due to vaginal examination. That is Ferguson reflex. Clear. Next is contraction of the myometrium. How the myometrium is contracting? Like, as you all know, actin, myosin, ATP, and other light chains plus calcium will increases the myometrial contraction. And what is known as a welcome sign? What is known as welcome sign? So lightening is known as a welcome sign. Okay. So, you know, when the labor starts, there is two pains, that is true labor pain and false labor pain. What is false labor pain? It is otherwise known as Braxton's contraction. It might, for suppose this is the uterus, it may be the false labor pain can be from any part of the uterus, or it shall be a generalized pain. There will be contractions, but it might be painless, or it won't be increasing. The pain won't be increasing. That is false pain. What about true pain? In the true pain, the foci of origin will be at the anterior portion of the uterus. The pain will start from a portion, it will radiate to the lower portion of the uterus. The pain might be radiating towards the anterior part of the vagina, to the inner thighs, etc. Okay, and the intensity of the pain shall be increasing. Okay, so that is what is happening in true labor pain. So in true labor pain, show will be the bag of water. You know what is bag of water, right? So in the uterus, if a baby's head is placed like this, so at this portion, see, it will be present in the amniotic fluid. So this is known as bag of water. When we rupture this, that is known as rupture of membrane. So what artificial ARM, artificial rupture of membrane, what we are doing here. Okay, so next we'll focus on the stages of labor pain. Sorry, stages of labor. So this is important, my dear. So you might get questions from this. Okay, so it is first stage, second stage, third stage, and fourth stage. It's simple. So what is first stage? So onset of true labor pain, true pain, onset of from the onset of true labor pain to full dilation. Okay, full dilation of what? Full dilation of cervix. So that is first labor, first stage of labor. It might be it can be up to 12 hours for primary, and then 4 to 6 hours, 4 to 6 hours for multiparas. And the second one, that's from the full dilation, to what? Expulsion of fetus, right? So it may take around 2 hours or 30 minutes also, in case of primary. And what is third stage? That is expulsion of the fetus, to the expulsion of placenta, expulsion of fetus to the expulsion of placenta. That is within 15 minutes, right? 15 minutes is the answer. So what is fourth stage? Yeah, fourth stage is expulsion of, expulsion of fetus to what? Maintaining homeostasis. It might be 1 to 2 hours. So these are the stages of labor pain, right? Is that clear?
Yes, sir.
Okay, and one more thing, this is the uterus. So here, this is the pacemaker, we can say. From here, from this area, the pain starts. This is tubal ostia. Okay, this is known as tubal ostia, or the pacemaker in the uterus, tubal ostia. So contraction, what is the rate of the contraction? It will be 10 to 20 seconds, the rate of contraction. What is the pressure? So in the first, in the yeah, 40 to, it might be 40 to 50, that is in the first stage. So during the second stage, it may be 100 to 120, that is in the second stage. And intra-amniotic pressure, what is when contracting? What is the pressure when the uterus is contracting? Intra-amniotic pressure, amniotic fluid pressure. It is 20 mm of Hg when contracting and 8 mm of Hg when relaxing. Okay, and what is the cause of the pain? What is the cause of the pain? What are the causes? What are the causes of uterine pain? So when a muscle mass is contracting vigorously, will the blood flow increases to that area or decreases to that area?
Decrease.
Yeah, it decreases to the area. When a muscle itself is contracting, there will be vasoconstriction, right? So when there is vasoconstriction, when there is vasoconstriction, the blood circulation will be decreased. So the first cause is myometrial contraction. So when myometrial contraction occurs, there will be myometrial hypoxia. Okay, myometrial hypoxia. That is one reason for this pain. Second is peritoneum stretch over fundus. The peritoneum will be stretching over the fundus. That is the second stage. Peritoneum will be stretching over the fundus. Third one is cervical dilation. So cervical dilation will cause pain. Then last one, nerve compression. Nerve compression. So nerve compression will also leads to pain. So where you can see the nerve compression is from T10 to L1, thoracic 10th vertebra to lumbar first vertebra. That is known as sacral plexus. Okay, this area, sacral plexus. That's why apart from coccygeal dilation, there is a compression of the nerves, which is from T10 to S11, or known as sacral plexus back pain. Okay, so next we'll see what are the events of first stage of labor. So yes, see the events. So this one is the events of first stage of labor. Sorry, first stage of labor events. So first stage of labor. Okay, what are the events in the first stage of labor? So we can say first one as what, dilation of cervix. There will be dilation of cervix. Dilation of cervix. Clear? There will be dilation of cervix. So what happens when the cervix is dilated? So what are the first stage of labor? What happens in the first stage? First one is cervix will be dilated. Then what happens in the first stage? What happens? Cervix will be smooth. Okay, cervix will be smooth. Cervix will be smooth. Why cervix is smooth here? Why cervix is smooth here? Because of increased circulation. Okay, accumulation of fluid will be there. Then collagen breakdown. Okay, so the main thing is dilation of the cervix. So why is cervix is smooth? You know the smooth cervix will be smooth, right? So due to increase in the circulation as well as accumulation of fluid. So what are the factors which is responsible for cervical dilation? What are the factors which is responsible for cervical dilation? First one is uterine contraction and relaxation. The first one is uterine contraction and relaxation. Second one is bag of membrane. You know the bag of membrane. Third point is fetal axis pressure. So in the uterus, if the fetal axis is like here, it will increase the pressure. So fetal axis pressure. Then what? Vis et ergo. Have you heard about vis et ergo? BIS. Vis BIS et ergo. What is vis et ergo? What is vis et ergo? It is downward thrust of presenting part of the fetus and upward pull of the cervix. That is known as vis et ergo. So we know the uterus, the presenting part is applying a pressure downward, whereas the cervix is applying a pressure upward. Okay, downward thrust of a presenting part of the fetus and upward pull of the cervix. So that is vis et ergo. Then what happens in the dilation of the cervix? There will be effacement, right? What is effacement? Effacement means taking up of cervix. Okay, and one more thing, there will be physiological retraction ring. There is a physiological retraction. See, there are two conditions: physiological retraction ring and pathological ring. So what is physiological ring? That is the ridge between junction of upper and lower uterine segment. Okay, so this is the uterus and suppose this is the cervix. So it's the ridge between junction of upper and the lower. This is the lower uterine segment and this is the upper uterine segment. So there is this is the ring which might fall on the uterus. Okay, it is around 7 centimeters from the internal os. Okay, from the internal os. So this is the first stage. Next is the second stage. Second stage of events in the labor. So what happens to the membrane? There will be rupture of membrane, right? Membrane will be ruptured and tendency to push back by positive, which increases its connect by the retractions. There's a pushbacking mechanism will be there. Okay, in the second stage. And what are the events in the third stage? What happens in the third stage? What happens? So what is third stage? In the third stage, baby is already out, right? So next we have to check the what placental separation. So the uterine membranes. So uterine membrane will be discoid in shape. Okay, uterine membrane will be discoid in shape. Then what? Yeah. So the placenta, how the placenta is separated? There are two methods why the placenta is separated. First one is what? Schwann's method. Schwann's method. So how it is separated? What is Schwann's method? It's known as central separation of placenta. For example, if this is the uterus and this is the placenta, so there is a central separation from here first. From this portion, the uterus is the placenta is separated from this portion. Okay, So like this, the placenta will be separated. This is Schwann's method. Second method is Matthew Duncan's method. Matthew Duncan's method. Matthew Duncan's DUNCAN. DUNCAN. So what is Matthew Duncan's method? That is marginal separation. Okay, so from here, from both sides. This is Matthew Duncan's procedure or Matthew Duncan's separation of the placenta. Then expulsion by bearing down effect. So that's why that's how the placenta is expelled. Expulsion by bearing down effect. Okay. Next, so these are the events that takes place in the normal labor stage 1, 2, 3, and 4. So what about in 4? So placenta is expelled. The next is about attaining the homeostasis. So when attaining when the baby, when the lady have delivered a baby, next is the complications which we have to focus. The main complication is bleeding, and why the bleeding, you have to monitor the bleeding. If in some time when you're taking the placenta out, the all the cotyledons might not be uh, uh, gone out of the uterus. So that's why, you know, in the you in the placenta there are 20 to 22 cotyledons. So after the delivery of the placenta, you have to calculate the cotyledons, or you have to check whether there is any space in the cotyledons of the placenta. So when checking the in assessing the fourth stage, have to check whether there is any retained placenta present. Okay, so if there is a retained placenta, there is chance of bleeding. So next is mechanism of normal labor pain. Mechanism of normal labor. So we are considering as LOA as the position, that is left occipital anterior. First stage. What is first stage? First stage is engagement, right? First stage is engagement. So what is engagement? So actually, why engagement occurs is due to lateral inclination of the head, and the sagittal suture does not strictly compose with the available transverse diameter of the inlets. Instead, it is either deflected towards the symphysis pubis or posteriorly towards the sacral promontory. Such deflection of the head is related to the pelvis which is asynclinism. Don't go with all those see, so this is your when this is your pelvis, and if this is the head of the baby, when how it is, suppose this is eye. Okay, so this is left occipital anterior. So engagement means the head is entering into the maternal pelvis, that is engaging. Second one, descent. What is descent? The continuing process of baby's head or baby is descending into the pelvis. Okay, engagement means the baby's head is entering into the maternal pelvis. If the head is engaged, we won't be able to tilt it, or the Leopold maneuver which we are assessing. So descent means, so when it enters into the, the pelvis is having inlet, outlet, as well as a cavity. So when the what happens when the descent happens? So when the descent, or during the descent, the baby's head will be descending towards the lower portion. So here also we can check the stations. Okay, 0 is the station, and -5 to +5 is the station. Okay, that is the station. Next 3 is flexion. So what happens in the flexion? So when the baby touches the pelvic floor, it can't go further in the same direction. So when the baby's head touches the pelvic floor, due to the resistance of the pelvic floor, there is a chance of flexion of the baby. So flexion occurs. So what happened after flexion? After flexion, there is an internal rotation. Okay, internal rotation of the head. So after, so when the baby is internal, when the internal rotation of the head occurs in order to maintain the LOA position. And the fifth one is torsion of neck. So the neck will be tilted. So in this SS6 position, there will be crowning. So you can see the head of the baby. That is crowning. Seventh is extension. So when the baby's head is out, since the baby was in a flex position, there will be an extension position. Next is resuscitation. Sorry, restitution. Restitution. So what is restitution? So passive movement of the head due to untwisting of the neck. Okay, when the neck is untwisted, there will be restitution. And ninth point is external rotation. So when the baby is out, not completely out, his shoulders are out. That is due to internal rotation of the shoulders. When there is an internal rotation of the shoulder, there is an external rotation of the head. And the last position, birth of the shoulders and trunk. Birth of the shoulders and trunk. Body is expelled from the vagina. So that is about engagements, mechanism of labor. I hope all these things are clear to you because you have studied and you're very much more experienced than me and gynec. So that was about the mechanism of normal labor pain. Next is clinical causes. So what are the clinical causes that happening? So it's same as the events. In the first stage, we know that there is a cervical dilation will be that might be in one finger dilatation. One finger means around approximately 1.5 centimeter. Okay, so in the first trimester we'll check the partograph. So who have introduced partograph? It is Friedman. F-R-E-I-D. Friedman. F-I-E-I-D. Friedman. So Friedman has introduced the partogram in Friedman have introduced the partogram in 1950. Yeah, 1954. In 1954, and there might be rupture of membrane. Rupture of membrane may occur. Next is the clinical course in the second stage of labor. So bearing down effect will be the, or the descent of the fetus will be the, we know the stations, like, so stations, when we are saying 5.5 is the station, it is floating above the brim. Okay, 4.5, it is getting fixed but not engaged. So 3 to 5 means not engaged. Here just it's coming to fix. It coming to fix. 3 by 5 means it is not engaged. Not engaged. And what about 2 by 5? Just engaged. Okay, 2 by 5 just engaged. And 1 by 5 station 1 by 5 is engaged, and 0 by 5 is deeply engaged. Then in the third stage, what you have to check? In the third stage, you have to check the placental separation, how the placenta is separated. Then umbilical cord cutting, how will you cut the umbilical cord? Then is Apgar scoring. Apgar scoring. What is Apgar scoring? Appearance, pulse grimace, appearance, pulse grimace, what respiration and activities. Next is REDA. What is REDA? REDA scoring. What is REDA? Redness, edema, ecchymosis, discharge, and approximation. Okay, so in REDA, we'll check the lochias. There are 3 types of lochias. Lochia rubra, which is in red in color, which is mainly seen 1 to 4 days. Then what? Lochia serosa, which is yellow in color, then 5 to 9 days, and Lochia serosa. Sorry, alba. Lochia alba, Lochia rubra, Lochia serosa, Lochia alba. That is around 10 to 15 days. So that is which is done in the what? Which we check in the radar scoring. So I hope this is what we needed for the exam purpose. Okay. So thus we have completed the physiology and other things. Next, we can move to the abnormalities of the the obstetric conditions. Okay. So I think that the Zoom time is going to complete. Okay. So let me cut from here. We shall join in the next session. And okay, thank you guys. So do you have any doubt till here? Aisha, do you have any doubt in here?
No, sir.
Selena, Shiny, do you have any doubt?
No, sir.
Okay, then fine, guys. Munira, I
So
hope
next session is not now or tomorrow, sir.